So,
Okay.
good evening, all the aspirants. Good evening, sir. So, the topic is metabolic disease, and the speaker that we have here is Dr. Vinod Jaiswal, sir. He is a consultant critical care at Medicare Royal Specialty Hospital at Dubai. Thank you, sir. You may carry on.
Yeah. Can you see my screen?
Yes, sir.
Okay. Um, Today's topic is very important, not just for MRCP, I would say, for in future, for wherever in clinical practice you work, if you can, whatever specialty you choose, if you can do a basic assessment of arterial blood gases, it will be very helpful. Many times, non-ICU or non-ER physicians or doctors don't know how to even see the simple acid-base gas analysis. I think, and after this lecture, at least you would be able to solve most of the clinical questions, basic clinical questions easily. Let's see. Okay. So basics, nowadays there are multiple parameters, but these are the very common parameters every blood gas has. If you read any blood gas, but now advanced ABG machines have many other parameters, but these are the most important and most common, which are accurately measured by a blood gas machine. Okay, so pH, partial pressure of oxygen, and partial pressure of carbon dioxide is directly measured. The others are calculated from different calculations and algorithms like bicarbonate, saturation, then base excess, and base deficits. These are derived and calculated parameters. Indications mainly, you want to interpret the acid base status, whether it is respiratory or metabolic. And the second most common use is to know the ventilation and perfusion of lung and pulmonary gas exchange in hypoxic patients or hypercapnic respiratory failure. Very commonly used these two indications. I'll skip this slide for the time being because we don't. Any ABG report is given, they are not going to ask you it is valid or no. But in clinical situations, if you are doubt on the blood gas report from the clinical condition, you can do those calculations. I think it is too much for the time being. So we'll go on the basic interpretation of acid blood gas. Okay. So to look for a metabolic acidosis or alkalosis, so or the respiratory, you have to check pH. Any question? All right. You have to check pH, bicarbonate, and PaCO2. These are the three things you have to check, and depending on their values and compensation, you can decide about whether it is metabolic or respiratory, compensated, non compensated, or the mixed disorders or triple disorders. Okay. Check carbon dioxide for ventilator status. Ventilator status means basically carbon dioxide removal, and basically it is the functioning of the pump, ventilator pump, which includes diaphragm and your respiratory muscles. So basically type 2 respiratory failure. And check partial pressure of oxygen for oxygenation status, PaO2. Um, any ABG which has a PaO2, it has no value as long as you don't know what is the level of support oxygen patient is receiving, either through the ventilator like FiO2 or oxygen mask or non-breathing mask. So you need to know what level of oxygen is patient is having, and the according to that PaO2. Because normal patient, any patient can have a PaO2 of 70, but that PaO2 of 70 could be on room air and could be on 100% oxygen on the ventilator. Understand? So that is very vital when you look at the blood gas. So you look at the level of oxygen support he is receiving. And anything, if you don't understand in between, you can ask questions. Okay, please. Let's see the basic interpretation, how you can go ahead when you see the blood gas. These are the steps in interpreting ECG, sorry, ABG. You look at acidosis or alkalosis, you have to check pH, correct? So normal pH is around 7.36, 7.37. If it is less than that, that means acidosis, and more than that means alkalosis. Then look at respiratory or metabolic. To look at that, you have to look at carbon dioxide and bicarbonate, right? If CO2 is elevated, it goes to respiratory acidosis, and if bicarb is decreased, that goes to metabolic acidosis. Then you decide about a primary diagnosis. Okay. Anyway, in the further slides, there are examples and interpretation will come. So these are the steps basically. First, look at pH, whether it is acidosis, alkalosis. Then look at PaCO2 and bicarbonate, whether it is respiratory or metabolic. If PCO2 is involved, it is respiratory. If bicarbonate is involved, whether high or low, it depends, and it's metabolic. So you decide about a primary pathology, primary respiratory acidosis or alkalosis, or primary metabolic or metabolic acidosis or alkalosis. That is your primary diagnosis. Then you have to check compensation is adequate or no. What is the compensation? Compensation is a mechanism by which any kind of acidosis is developing, body tries to balance it out by counteracting those mechanisms. For example, if patient is having he's hypoventilating and carbon dioxide is going up, so pH will drop. So body will try to retain bicarbonate through kidney and trying to normalize the pH. That is called as compensation. Let's say patient is having acidosis or renal failure, so patient will try to hyperventilate and decrease the PCO2 to try and bring the pH towards normal side. That is called as compensation. And sometimes compensation may not be adequate. So patient may have a dual problem or a mixed disorder. We'll see in the coming slides how you can interpret. Any one of you experience an interpretation of blood gases, guys? You guys,
Yes, sir.
Yes, sir. Yes, sir.
okay, so you guys look at every day in your
Yes,
practice?
most probably. Yes, sir.
Oh,
Yes, sir.
okay, okay, all right, good then. Yeah, so this may be very basic for you guys, is it, or is okay to go ahead like this?
No, we will go like this only, sir. No problem.
Okay, all right, okay.
Yes, sir.
Let's say, so when you analyze, you should know the normal range of parameters when you look at the blood gas. So pH between 7.35 to 7.45. PaCO2 generally we consider 35 to 45, but for calculation we take normal value as 40. Bicarbonate also 22 to 26. For the sake of calculation, we take the value of 24. Yeah, that's what I mentioned. For calculation purpose, the base is pH is 7.4, PeCO2 40, and bicarbonate 24. This I already discussed. Less than 7.35 acidosis and more than 7.45 alkalosis. Many a times when you look at the blood gas and you tell, let's say pH is 7.32, but someone casually just mentioned 7.3. So every decimal also counts here. So after second decimal also it is important. So 7.35 and 7.3 is a lot of difference between these two. They are not both equal, right? So you always mention two decimals. You should mention whenever you review. Okay. This is for example. Okay. Sorry. So pH 7.3, CO2 60, bicarbonate 30. Right? Clearly, pH is less, so that means acidosis is there. But now, which one is the primary? Bicarbonate is 30, CO2 is 60. So, what do you guys think? What kind of acidosis it is?
Respiratory acidosis. Respiratory acidosis.
Okay. So, and compensation adequate or no? You guys can
Adequate
calculate?
compensation with metabolic alkalosis.
Okay.
Compensatory, full compensation.
I think respiratory acidosis is partially compensated by the renal.
Okay. Let's look at, is it adequate? Do you know how to calculate? Adequate compensation?
Yeah, there is a formula actually. It's a big formula.
Okay. Let's go. We'll discuss this. No problem.